Thank you very much for inviting me to speak today, and Happy New Year, CIICA. Next slide, please. I would like to just quickly explain who we are as the European Federation of Hard of Hearing People. Our goal is, like we've been hearing today, a Europe without barriers for hard of hearing people. Without barriers, it also means without barriers to access to hearing care, and which gives us an opportunity to also participate at all levels of society. We were founded in 1993 and represent around 57 million hard of hearing Europeans. We realize our vision through action, publications, projects, campaigns, and we are involving our members in our work. Today, actually, I'm very pleased to see many members joining. And our work and our foundation of the work is United Nations Convention on the Rights of Persons with Disabilities. Next slide, please. So what has happened when pandemic struck in Europe? It's actually not much different to the rest of the world, but as we know, the general practitioners, the first point of contact, have immediately moved to online consultations. Training, education, as we have heard already, employment has moved to online platforms. Local authorities, rapid response teams, they all moved to telephone lines. This was just like that, very quickly created. Televised COVID-19 briefings were inaccessible in many countries in Europe. There were no live subtitlings and sometimes also no sign language interpretation. And then hearing care, something that we are discussing today, services have also stopped. And now we all know the figures, but just remind us ourselves that there is a 5% of the world population which presents with a disabling hearing loss. And approximately of those, 1/3 are over 65 years of age. And of course, one of the main issues is communication, an ability to communicate with others. Now, people over the age of 70, especially were asked to isolate themselves and to keep themselves safe because they were at greater risk of contracting COVID-19. But also those people, in greater majority, had hearing loss, which added on to the isolation. Next slide, please. So at National Association of Deaf People, we asked our members to take to social media and tell everyone what are the main barriers they have faced. As you could probably guess, in majority of the situations, masks, but also communication, contacting doctors, contacting services, and complete lack of awareness sometimes in many different public places. Next slide, please. Now, a late deafness and the pandemic has collided with each other. Myself, when I suddenly lost my remaining hearing, I found the situation challenging, but my skills of lip reading have helped me to manage as much as possible communication while I was waiting for my cochlear implant. But unfortunately, this is not really as simple when it's a pandemic and everybody wears face masks. Late deafness especially has a radical, far-reaching effect because it stops us from communicating. And during the pandemic, because of the restrictions in general, that isolation was even higher. And of course, the pandemic result, as Professor Davis already said, long waiting lists for assessment. Next slide, please. So what is the quality of life for people with hearing loss? It's part of a wider inclusion. Yes, it's important that we have access to hearing care, hearing technologies such as cochlear implant, but also awareness and empathy is important to around us. Accessible society and equality is as important as ever. And then we have already heard peer networks. They are so important to support IJETA and to help IJETA in the challenging situation and accessing information. Next slide, please. So we do have the telehealth, which has been a massive shift from how the services have been delivered previously. And telehealth is here to stay. But there is a but. While telehealth offers new outreach opportunities, and we have heard of them as well in general, rehabilitation tone, deployment of inaccessible online platforms did actually create new barriers during the pandemic. In many situations, live captioning, which actually existed in the platform, was not activated, and many services did not even understand the need for example, speech-to-text reporters, which we call in UK, or writing interpreters. So at my work with the International Telecommunication Union, what I have come across is many discussions globally taking place, because this was not unique to Europe, to UK. It was a situation globally which many people with disabilities, especially people who are deaf or hard of hearing, have encountered. And the World Health Organization, together with ITU, have responded to this situation by developing global recommendations for accessible telehealth. And those recommendations were developed by working together with many experts with disabilities and associations. Those recommendations are at the final stage and should be published this year. Next slide, please. But then we do not have to wait for the World Health Organization recommendation. We can already do a lot of things to improve the situation as it is now. So, because COVID has exposed those inaccessibilities, in addition to telephone contact, we should be offering a range of ways for appointments. Provide email contact. Provide video telehealth appointment, which use accessible platform. Make sure you have an accessible platform, and enable captioning, as well as allow the third-party support in communication, be it speech-to-text or be it interpretation in sign language. And also provide mobile number for SMS conversations. Quite often, the systems are being used which are just sending out SMS notification, but there is no possibility to respond back. You have to call back. So accessibility, in fact, is a precondition to active participation in healthcare. And we want to make sure we provide the accessible information to everyone, and as much as information to ensure that patients understand their care. Next slide. And accessibility and also clear communication is important. We all can improve it. I mean, most of the service providers, of course. Make sure the appointments are accessible to your patient. Have you planned for accessible appointment? Did you check what communication is? Especially someone who is completely deaf, late deafened person will need speech-to-text most likely, unless they know sign language. Provide instructions right to home. There is more and more discussion of cognitive overload. And it doesn't matter if this is during the online appointment or if it is during the face-to-face appointment. The need to listen or to try to understand what's being said, it's so important that we get extra information to take home, because the cognitive overload is just simply giving us a situation when we forget. And also give extra time to answer questions, because the appointment is already a stressful experience, especially when the technology doesn't work when you do it online. Next slide. So let's work together to build back better, a reality, not just a wish. Thank you very much, and I look forward to your questions. Thank you.
Thank you so much, Lidia. Accessible telehealth, it seems so obvious, and yet has not been necessarily available. Brian, any comments in the chat line?
Lidia, I think people are interested. So what is the kind of most crucial issue that you think we should be focusing on in that agenda you've just set out there?
Could you rephrase this?
Yeah, out of the different issues you've talked about, what is it that, say, CIICA should be focusing on, really pushing?
I think CIICA should be focusing on outreach, but at the same time, we should be talking about cochlear implants, because sometimes there is a discussion of cochlear implants or hearing aids as resolving all issues people with hearing loss have. But actually, it's a huge positive step forward, but we still do not hear as well as someone who doesn't have a hearing loss. And therefore, in the challenging situations, or be it in the conferences online, or in just general face-to-face, we still do not fully understand or hear. Because sometimes people also conflict hearing with understanding. We can hear quite well, but yet when people speak to us, our brain is not processing it as fast because of who additional baggage we have of technology, etc. So it's important that we do talk about technology and we do talk about accessibility, as they are not conflicting with each other. They are actually working together and complementing in a way.
Thanks. Really helpful answer. Thank you. Kathy, back to you.